Leishmaniasis has been reported to occur in 1 out of 100,000 live births. As women, we need to know that there's a possibility that we may be the carrier of this disease. And as for men, they need to realize their son could have a chance of being born with this rare genetic disease as well. Leishmaniasis is a rare condition that affects children at a very young age. I will now discuss the causes of Leishmaniasis, the signs and symptoms of Leishmaniasis, and the treatment of this disease. First, I'm going to talk about the cause of Leishmaniasis. The disorder, it's passed down through families, so it's inherited, and the women are the carriers. The men are not the ones who pass along this disease. So if a woman has a daughter, when the daughter is older and she decides she wants to have children, she should maybe be checked to see if she is a carrier of the disease as well. According to Medline Plus, it's passed down through the X-linked or sex-linked trait. Typically, they find or diagnose the disease when they look for HPRT, which is hypoxanthine guanine phosphorybosal transferase. And if there's an absence of HPRT, then they are diagnosed with Leishmaniasis. The body needs the HPRT to recycle purines because without this, they will have a buildup of uric acid, and the buildup causes harm to the kidneys and other organs. The disease is usually present by the age of 3 to 12 months. Second, we're going to talk about signs and symptoms of the disease. One of the first signs that are usually viewed are orange-like crystals in a baby's diaper, and this is from excess uric acid. It's kind of sandy. Then they will have growth and developmental delays, so any major milestones that a child usually hits, such as crawling, holding their head up, anything like that, they won't do until later on in life. Usually, I would say past a year old. And then after a year old, they will start seeing that the child will have spasms and facial spasms of their limbs and face. And due to the developmental delays, they have difficulty speaking as well. And they're very, very hard to understand, which kind of causes them to be stressed out because they're trying to communicate and people can't understand them. So I have worked with a guy who has it, and you have to listen very carefully when they're talking to you. They're unable to walk or stand due to excessive loss of motor control, which makes them dependent upon wheelchairs. And then according to WebMD, they have impaired kidney function and acute gouty arthritis, which is inflammation of their joints, and it's very painful for them. And this is caused by the high levels of uric acid in their body. And so sodium urate crystals may form in their kidneys or in their joints as well. They're known to have self-mutilating behaviors such as finger biting, like they've been known to bite their fingers off, cheek biting, lip biting, they'll bang their head, and usually they only do this during high levels of stress. And as they get older, their behaviors tend to decrease, but they still have it, and they're very manipulative people as well. And I have a picture of when they bite their lips, they just they'll bite holes in their cheeks sometimes. And then here's a picture of a finger. The middle finger you can see is missing. Let's see if I can dim it a little bit. There we go. They have involuntary muscle movements and neurological impairment as well. Third, I'm going to talk about the treatment of Leishmaniasis. According to Syndromespedia, there's no specific treatment to cure the disease. Treatment is mainly just to help decrease the uric acid levels in the body and to control other symptoms such as their involuntary muscle movements. Their life expectancy is reduced. Typically, they don't live to be past 35. There are some cases, though, where they have lived to be 40. The guy I take care of, he's 41, I believe. So it is possible. Mainly just depends on the care that they get. Allopurinol is a medication given to help decrease the level of uric acid present in the body and to prevent any formation of stones. You want to push fluids. They want to drink lots and lots of fluids to help try and excrete the uric acid out of their body. They're given muscle relaxants to help with muscle spasm and other neurological problems. They're given haloperidol, which helps with the behaviors. And also a comfortable wheelchair is important to help with their comfort because they have a lot of muscle twitching. They can't control it, and so you want to make sure they're kind of padded in so they don't get hurt. Again, Lesch-Nyhan is a rare condition that affects children at a very young age. We have went over causes of the disease, signs and symptoms of the disease, and treatment of the disease. I've always been intrigued by this disease since I started working with a guy who has it, so I thought it was an interesting disease to share with others.